Anybody on the higher end of the age brackets in the Lowcountry is already getting inundated with the information. It is time for Medicare enrollment for 2026, hopefully helping us cut through some of all of that. Benjamin Kornitzer, Dr. Benjamin Kornitzer, Aetna's Chief Medical Officer for CVS Health. Doctor, welcome. We could talk for 2 hours. We've got 5 minutes. What's the most important couple of things we need to know about enrolling in Medicare Advantage programs for the coming year?
Yeah, so between now and December 7th is when people can evaluate their plans and make the selection that best fits for them. And Medicare Advantage is again for people over the age of 65 who are eligible for Medicare. And it's really designed to think of their total health needs. And so think things through like capped on the out-of-pocket spending, help with prescription drugs, but then also some unique features. So for example, with an Aetna, all of our plans next year include dental, vision, and health, really important for seniors.
Okay. What are the big differences this year over last year? Costs are going up, I would imagine.
I think this is a really good time for people to go and take a look at healthcare.
Yeah.
And one of the things that, again, is unique about Medicare Advantage is the ability to say, how's this going to fit in their budget? So are prescription drugs that they need covered? Are the providers that they see covered? And then, there are things about Medicare Advantage that we can talk about that might be customized for people's specific needs, whether they have a chronic condition like diabetes, or maybe there's someone who also is on Medicaid, in which case there's special programs to support them as well.
There is a lot of information online. The Medicare.gov website is actually pretty darn good for comparing different kinds of plans. But is it still better to actually talk to somebody, to talk to a human being, to go through the process that you've been talking about?
Yeah. So again, listen, everyone's got a different approach to engaging with their healthcare. I've always enjoyed a trusted advisor. I think through people that I trust and develop those relationships. But there's, like you said, a wealth of information online. If they go to the Medicare.gov website, they can see, in your zip code, what plans are available. They can pick up the phone, call those individuals to find out more as well. And so I think there's a bunch of different ways that they can engage to really learn what's the best fit.
Do most people who do consultations for all of this, are they pretty good about giving you general information as well as, obviously trying to sell their plan?
Yeah, so I think the thing to do is the more specific, you can be in terms of your needs, the more specific they can be in terms of, what they're able to share. And again, I think that the things that people should, take a look at are the providers that you care about included? Are the medications that you care about included? But there might be other benefits that are really important. So, for example, fitness programs, do you have access to those without charge? Are there flexible accounts to let you spend money on healthy food items or over-the-counter items? Are there ways to engage in sort of your mental well-being and in programs like yoga that we know really just energize people and promotes their well-being? So I think you should really think through what are the things that are meaningful to you, and then work with those individuals to help figure out the pros and cons, the different options.
Yeah, you've done a really good job of creating a checklist of things, because I'm sitting here in the middle of October wondering, okay, what do I need to ask about? What do I need to be thinking about? Because I've been pretty healthy this past year, but what are the things I might stumble over? And this is a great, what you created there is a great checklist. Any things we should be wary of? Any pitfalls, any traps along the way that we need to watch out for?
What I would say the most important thing is that given the time in the year that we're at right now, people that have Medicare Advantage will have received notices in September, just talking about how those plans have changed. So they should make sure that they understand all of those changes, read it carefully, because they've got this window between now and December 7th to really choose a plan that fits best for them. And so I think that's, would be my big takeaway.
Yeah, and maybe don't wait till December the 6th.
Definitely not.
To make decisions. Thank you so much, Doctor. We appreciate all the time and the information. Again, Benjamin Kornitzer, Dr. Benjamin Kornitzer, Aetna's Chief Medical Officer for CVS Health. Thanks for joining us.
Thanks for having me, Bob.
We want to thank all of our guests for making us just a little bit smarter over the last 30 minutes, and a special thanks to you for tuning in. If you missed anything at all, we'll be back in 90 minutes. I'm Bob Stevens.